So I have a broad range of research activities and research interests, but predominantly there's two areas that I focus on. The first one is non-pharmacological interventions, such as lifestyle interventions, and in particular physical activity and exercise for chronic conditions. A second area of my research focuses on research, so how well are we conducting the research that we're doing as researchers, and in particular around evidence synthesis and systematic review methodologies. So I've been fortunate to work on a number of interesting projects, but one I'm particularly proud of is a project where we looked at the underlying systematic evidence to support physical activity and exercise for treating chronic diseases. And the reason I'm proud of this one is because of the potential impact it's having in the real world. It's now being used to inform guidelines put out by the Royal College of General Practitioners to their doctors in using evidence to inform their discussions with patients, as well as a new project funded by Public Health England, which is looking at a moving medicine campaign, and some of this work is underpinning the resources that they're now using. So I've been fortunate enough to supervise a number of both MSc students as well as DPhil students. And in terms of the impact of some of our work, last year alone, one of my students went on to be awarded the prize for one of the best MSc dissertations and is looking now to be putting that into peer-reviewed publication. And in terms of the DPhil supervision, many of our students and many of the projects I've worked on have also gone on to be published in the peer-reviewed literature as well as inform national guidelines. So one of the MSc projects I supervised looked at the evidence base for the incidence of sudden cardiac death in young athletes and military personnel. And that went on to be published in an international journal, a peer-reviewed journal. Another DPhil project that I'm currently supervising is looking at the ecosystem of living evidence, and in particular living systematic reviews. And we're moving in a direction where we think the evidence that we're gathering together should be looked at in a live process and continuously updated. But there's not much methodology around that at the moment. And one of our students is going to be looking at that in more depth and hopefully informing guidelines and methodological practice around that particular topic.